In this video, we're going to dive into the art of medical diagnosis in wilderness settings, specifically focusing on understanding the significance of vomit color and consistency. To enhance your learning, we'll be utilizing a unique tool, Wilderness First Aid Workflow Diagrams. I pioneered the integration of these diagrams into first aid training 7 years ago. These diagrams are revolutionary in wilderness medical education. They provide clear, visual, step-by-step instructions, transforming complex medical procedures into simple, easy-to-follow guides. This approach not only makes learning more efficient, but also aids in memorizing crucial emergency techniques. The diagrams ensure uniform training standards, facilitate rapid decision-making in urgent situations, and bolsters confidence by offering a handy, easy-to-use reference under pressure. And for your convenience, you can download the specific workflow diagrams we discussed today via the links in the video description. Additionally, the complete collection of these diagrams is featured in my book, Wilderness First Aid Made Easy, which is available for purchase on Amazon. You can find the purchasing link in the video description as well. Join me in exploring this vital aspect of wilderness medicine. In Wilderness First Aid, understanding the color and contents of a patient's vomit can be crucial in diagnosing their condition. Vomitus can provide vital clues about a patient's health status, especially when other diagnostic tools are unavailable. Normally, vomit usually contains undigested or partially digested food and can vary in color depending on recent meals. It's typically a shade of yellow or brown and may have a slightly sour smell. The consistency can range from chunky to semi-liquid. So let's discuss how to assess vomit by color and contents. Clear or light yellow vomit, often just gastric juices indicating an empty stomach. Common cases is a stomach flu or excessive alcohol consumption. Green or dark yellow vomit can indicate bile presence, usually seen when vomiting on an empty stomach or due to some sort of intestinal blockage. Brown or black vomit. This is concerning because it could indicate bleeding in the gastrointestinal tract. Usually they resemble coffee grounds. Red or blood-streaked vomit suggests fresh bleeding. Causes could range from a simple tear in the esophagus due to forceful vomiting to more severe issues like internal bleeding. Undigested food long after eating. This may indicate slow stomach emptying, possibly due to a blockage or other digestive issues. Some additional considerations. Refer to workflow diagram 11B, viral and bacterial illnesses, to assist in diagnosing patients presenting with vomiting. This workflow diagram will assist you in matching signs and symptoms of specific illnesses. A foul-smelling vomit can suggest bacterial infection or intestinal obstruction. Patients suffering from food poisoning may have vomit that contains undigested food with a foul smell. Persistent or large volume vomiting increases dehydration risk and may indicate a serious condition. Some other considerations. Consider other symptoms like fever, abdominal pain, or diarrhea to form a broader picture of the patient's condition. Run a thorough sample history. See workflow diagram 8B, sample history, to make sure you're asking all of the questions. So let's go over when to evacuate a patient who is vomiting. Bleeding. Any vomit resembling coffee grounds or containing fresh blood warrants immediate medical attention. Persistent vomiting. Continuous vomiting for more than 24 hours, especially with the inability to retain liquids. Severe dehydration. Look for the signs and symptoms of dry mouth, thirst, or reduced urine output alongside with vomiting. See workflow diagram 22, heat illnesses. In severe abdominal pain, especially if it's localized and intense, refer to workflow diagram 11, abdominal pain table. Vomit with suspected poisonous substances. If there's any suspicion the patient has ingested a toxic substance, look at this. and vomit accompanied by neurological symptoms such as confusion, severe headache, or visual disturbances, see workflow diagram 20, brain injuries, to assist you in your diagnosis. In wilderness first aid, the assessment of vomit is a vital skill. By understanding the different presentations of what they might indicate, a first aid provider can provide better decisions about the need for evacuation and the urgency of seeking professional medical care. Remember, when in doubt, err on the side of caution and evacuate the patient to professional medical care.